AM 1220, KHTS, hometownstation.com. This is T, and I'm here with a program we call Dr. Proctor, here every first and third Thursday of the month. It's an opportunity for us to glance over the shoulders of the medical community and support services to basically become our own best advocate, whether we're doing this for ourselves or for a loved one, with what they're calling the sandwich generation, where we're parents taking care of children or parents taking care of our parents, along with what they're calling the silver tsunami, an aging population that is going to require, as time goes on, more medical assistance or medical help. One of the best things we can do for ourselves is to be educated. This show gives us a chance, as I say, to basically peek over the shoulders, have a cup of tea with our medical professionals and support services so we can learn a little bit more so that we are equipped when we do have to go into the offices of the medical community and be ready for taking care of ourselves. With us today, I have Rick Ferrante. He's the president of Home Care Services Santa Clarita. You can find them at homecaresantaclarita.com. And also Dr. Taylor Levine, who's here from Unruh Spinal Center. Hello, gentlemen. Welcome to both of you.
Hi, T. Thanks for having us.
Thank you.
All right. One of the things I'd like to talk to you about, Dr. Levine, you work in chiropractics, and I'd like to know a little bit about you and how you came to take care of the backbone of America, if you will. How did that happen?
The backbone of America. I like that. I grew up playing sports all my life, and always admiring kind of getting into some sort of field to kind of help people out. Chiropractic caught my eye because I have been treated chiropractically ever since I was a kid, and just worked my way up through all the education. And
now, what was the sport of choice that you were getting hurt?
Oh, football, basketball, track, all that.
So whatever it was.
Whatever it was. Yeah.
Now, did you have any pre-existing conditions like a scoliosis or something that kind of lent itself to going in for some spinal work, or was it?
I think it was more or less the fact that I got whacked pretty hard in football one time, and my parents were slightly concerned.
Right, so off you went.
So off I went.
So, and as far as all the specialties, that was the one that caught your eye. Did it feel, in your estimation, that it was sort of whole body care, or what was the reason that was appealing?
Well, I felt that chiropractically I can do so much with it. I was going to go straight into sports and do athletic training, but I really wanted to be able to pinpoint and create my own diagnoses, my treatment plans for all my patients. And so that's when I learned more about chiropractic, not only just being treated by a chiropractor, but learning more about it to where I went, okay, this is what I want to do, rather than going the full medical field and just prescribing medications.
You could help, and you came from a place of wanting to be of assistance. And Rick Ferrante, Home Care Services, you also come at this from a tremendous place of compassion for other people.
Yeah, what we are is obviously much more general. So this is taking care of seniors in their homes. I mean, what we have, and you talked about it at the opening in your show here, that sandwich generation. So there is just this huge and growing problem here everywhere, where people don't have the time, the skills, the ability to take care of those people, their loved ones that are getting older, but they don't want to be don't want to lose that independence. So they want to be at home. They want to be able to continue to live the life that they've been living, in spite of the fact that there's maybe slowing down, having some issues, maybe getting around, issues, cognitively, whatever. There's all kinds of differences.
It's the ultimate in a support system to help on many levels.
And it's tough. And what kind of teaming up with Dr. Levine is there's a lot. Everybody has all their various different situations or issues, and when you are in a situation where somebody can go to a chiropractor, can kind of deal with whatever that one thing is, I'm in pain here, I'm whatever it is, we kind of deal with it, okay, after they walk out of that door. And, okay, now what? You have exercises to do. Maybe you have, the nutritional thing to do. You have whatever it is, and you can't just assume that just going someplace, once every couple of weeks and then walking out and then going back again every couple of weeks, that something's going to change. You've got to take those instructions. You've got to, be compliant with whatever it is that you're needing to do. And Dr. Levine at the Unruh Spine Center is great at kind of laying out that kind of plan for, and in this case, seniors, anybody, but in this case, seniors. But you got to follow it.
Right.
You got to do it. And it is tough for me, you, whomever, if our parents, grandparents, whoever it is, to take half a day and go and try to make that happen.
Right.
And a lot of times people need help with that because
And
they have
that's
their
what
jobs and families.
you guys are for. Now, chiropractic, typically, I think the average bear thinks, oh, chiropractic for, as you said, Dr. Levine, a young person dealing with sports. All right, we're going to go in, we're going to correct something. As life goes on, we're sitting, many of us, especially now, we sit at a desk, we sit in our car. We're not meant to constantly be sitting, so we come to a chiropractor to kind of correct that. Chiropractic for seniors. We're going to talk about whether or not it's appropriate. My very first, the thing I would be concerned about, I know that osteoporosis becomes an issue. Walk me through chiropractic care for seniors. What does that look like, and why should I not be afraid of that?
Yeah, so basically, chiropractic, there's many different variations and modalities on how you can treat a patient. And you're right, granted, if you're, say, a 16-year-old male or female, I'm going to treat you differently than I would a 65, 70-year-old male or female.
Different bodies.
Okay? Different bodies, different types. One, of course, has lived definitely a lot longer than the other, okay? We at Under Spine Cert and myself work with not only just, we can do high force techniques or low force techniques. It just depends on how that person is.
So it's very case specific.
Exactly.
So that is wonderful. And some of the services that you provide, I know, again, their office, Under Spine Center. You have a couple of locations. You have Valencia and a Newhall office.
Yeah. So we have 2 locations. We have our Valencia office, which is right off Valencia Boulevard. We also have our main office, which is on Lyons Avenue. Both, we all kind of run through the same core center at Lyons, and I mean, we offer everything from chiropractic to physical therapy, acupuncture, podiatry, and we also do have a medical doctor on staff.
Now, it's my understanding that with some of the changes, it's an open door policy. It used to be, in order to get chiropractic or physical therapy, you had to go to your primary care physician. They had to give you an order. How does this work at UNRU? Is this something where someone can come and say, hey, I've got a shoulder pain, help me? Yeah,
so the convenience with us, especially at Unruh Spine Center, is that we're that one-stop shop where we have kind of everything under one roof, to where for chiropractic wise, if you have insurance that covers chiropractic, you don't need a medical approval.
And that used to be the case. Everybody, that was the way you got in a car wreck, you got a slip of paper that says it's okay for you to go. But now it is one of those type of therapies where we can go in and not take the time of going to our primary care physician. I'd like to talk about what are warning signs that someone should be looking for that would indicate a need for a chiropractor. I've been on the planet half a century. I've got my aches and pains. Over half a century, FYI, tomorrow. The idea that, some aches and pains are normal. I was just traveling. I was carrying a heavy bag. I've got a pain in my shoulder. What are some of the things that we should be looking for before we call, for example, Dr. Levine, the senior chiropractic care?
Yeah, so when we're talking about seniors specifically, they've worked all their lives, and now hopefully at this part of their life they are retired, sort of thing. So they either have been sitting all their lives, they've been working on their feet all their lives, they've been doing and moving around. The thing with seniors is that now all these things will start to creep up, and they'll start to get these aches and pains that start to get a little bit more and a little bit more. And so I usually tell people, look, if you have any sort of pain is normal. Everyone has pain, but pain shouldn't be lasting more than a day or two. Mm-hmm. Anything that lasts more than that, then there is something that is going on that's causing that, and you kind of have to change what's going on to get that pain to go away. As far as seniors go, they're when they start to not be able to walk as far as they used to, or if they are having a harder time getting up off the sofa, or they're losing motion in their shoulder to reach up and pick something up off the top counter sort of thing. All those things are just subtle signs that, okay, you're starting to lose that motion and you want to just be able to regain that motion so you can live the last part of your years to your fullest and have fun.
Right. If we can take a moment and go back to some of the different modalities of chiropractic. Let's say someone comes to your office and it's exactly what you're saying. They're finding that there's a pain in their back when they reach for something, and they come to you. And what is the first thing, aside from signing in at the front desk and giving all that paperwork that we all have to do? What are some of the first things you're going to look at to determine what type of chiropractic care would be appropriate for the patient?
So a lot of times it's all comes down to the history of the patient. Everyone is different. Everyone has seen a chiropractor before or hasn't seen a chiropractor. Some of these, especially seniors, have been working with their hands all their life, or some have been sitting at a desk all their life. So it's all comes kind of down to the history in which it's talking to the patient, seeing what's going on with them, and also the little signs and symptoms that they're exhibiting. Most of the time, we can get all the answers we need just from that. I'm not prone to, as soon as you walk into our office, going, oh, you're over this certain age, yeah, I'm going to shoot an x-ray on you and just blast you with x-ray beams. It's
because that's not really something we should be doing, right? Just taking an x-ray every time. The
x-rays are
exposure's probably over a period of time not that good a thing.
Yeah, they do add up, but now granted, there are circumstances and times that warrant an x-ray. Most of the time with chiropractic care, and at least how I practice, and especially with the seniors that I work with, it comes down to the history. And then of course I set out a treatment plan for them. We of course follow that treatment plan, and if they are getting better, then of course, yeah, there's no need to get that x-ray. But when unfortunately sometimes things kind of plateau, and that's when getting those specific answers can kind of help not only myself but also the patients as well.
What if someone comes to you and says, I am having these pains, but I'm a little fearful of chiropractic because I can tell you for me, you guys always look like those old Bruce Lee movies. I'm always afraid you're going to end my life because you just don't like me and you snap my neck, because that's the way they do that in the movies. It's always been, I've been a little fearful. So suppose someone comes to you and says, I'm a little afraid you're going to Bruce Lee me on that table, and do I have options, or it's all your way or the highway?
Well, I mean, so it's a movie, right?
Yeah.
So it's all fake. No, but
came from somewhere, Dr. Levine.
It came from somewhere. Okay, no. Yeah, if that happens, and it happened to me this week with a patient. Someone
probably a friend of mine
is just really afraid of getting a chiropractic manipulation, and that's totally fine. I talk to my patients. I work with what they're comfortable with.
So you don't have to do the old school lickety-split, crackety,
For me, my low force technique, I use what's called, it's an adjusting device called an activator. It's low force.
Okay.
It works well for the people that are extremely afraid of getting adjusted.
Because I know that there are people who think, I don't know that I want to do that.
And it's just an educational process too with that. But also it's great for those seniors that have, a lot of osteoporosis in an area, okay, or are extremely fragile. That technique works really well with them.
And then you have other things at the center that you can use to help patients. Walk me through something like the pain treatment.
Yeah, so we have, other than the chiropractic adjustment, which of course is what I as a chiropractor specialize in, and creating more motion in the spine to, of course, relieve the nervous system and to where you can function better. But we have other techniques that we can use, such as ultrasound therapy. We also have laser therapy. And what's really big right now, which we're getting a lot of movement with right now, is what's called shockwave therapy. Not a lot of people have heard of it because it's fairly new to the United States. It's huge in Europe and in Germany. It really works for chronic pain issues.
And a lot of people, that's
yeah.
a constant, that's a way of life,
Yeah,
being in chronic pain.
Exactly. And so we have gotten great results with the shockwave treatment. Typically, a session on the shockwave treatment is 3 sessions, once per week. And after that, I'm going to say, actually, everyone that we've treated with it has a decrease of pain, if not a full resolved.
Wonderful. Rick, how can a home care professional interact with the chiropractor?
Yeah.
We've talked before about dealing with other medical professionals. How would they interact with your chiropractor?
Yeah, there's a couple of things and kind of a couple primary points. One of the things that Dr. Levine just talked about was the plan, right? The trying to put that plan together to what that person should be doing, this in case seniors, but whomever, to be doing as, for the day 1, day 2, the first week, etc.
Because there's follow-up and things they should be doing at home.
Yeah, and it is absolutely impossible to say that this is all going to have an effective outcome if that plan isn't followed. And it can be difficult, can be challenging, again, when you walk out that door. So, in my case, just thinking about it, I've got my own folks and the whole thing, and that's the challenge. I've got to call, I've got to go down there, I've got to deal with it so that they actually follow that plan. And that's the big thing. And then the last one is just mobility, maybe motion. We can talk about that maybe after, but getting people into motion is a big thing that we do to try to help alleviate some of these things.
Yeah, well, a lot of time that chronic pain, if it is inertia, not moving, and the idea that at home care services you can have different devices that will help with mobility and help patients get around. And it's difficult. I mean, anytime you leave a doctor's office or a therapist office and they'll give you that paper that says, okay, we want you to do these at home because we can't be with you every day. And in order for you to get that flexibility and to get that range of motion and to get that strength build up, these are things you have to do. You can't just show up once a week or once a month and think that everything is going to be okay. It'd be great, but there are things we need to help us help ourselves. And a lot of times having a cheerleader, which I really believe that home care services, that's what you do, is you help facilitate and be that cheerleader to make sure patients follow through.
Help put the plan into place.
The
plan doesn't make any sense if you don't actually do it. That's the biggest thing, because you can come back a million times and it's not going to happen. So it is literally taking that plan, understanding it, recognizing what it is, making sure I'm working with Dr. Levine or whoever, and if it's in different doctor, whatever it is, but Dr. Levine to go through and say, okay, this is what Dr. Levine's looking for, and this is what we have to do, and then communicating back to the doctor to say what's actually happening.
The liaison is critical because they will get the steps that sometimes the patient will forget and be able to translate often some things that the doctor said that maybe they missed, or I can tell you from my own family experience, they didn't want to hear. That is the even better thing. Yeah, the doctor will say something and then they'll come home and say, that's not exactly what the doctor said. So having that liaison is critically important. We're going to take a break. We're talking with Home Care Services. Rick Ferrante is the president of this company. You can reach them at homecaresantaclarita.com. Also, Dr. Taylor Levine, who's part of the Unruh Spinal Center. You can get a hold of them, Unruh Spine Centers, at 288-0022 or unruhspinecenter.com. UNRUH spinecenter.com. We're going to take a break. When we come back, we'll talk a little bit more about what exactly chiropractic care looks like for seniors, at really chiropractic care at any age, but especially for seniors. This is something we need to be looking at. You're listening to Dr. Proctor here on your hometown station, AM 1220, KHTS.